incredible expert speaker, Dr. Poonam Vaswani, with us. She is a clinical dietitian, onco-nutritionist, and she's having over 25 years of experience. And she's fortunately from Ahmedabad. I'm in our own city, Ahmedabad. So, a very welcome, Dr. Poonamji. And stage is all yours, and we look forward to all your.
Thank you so much, sir. And I would like to thank you for giving me this opportunity to speak to everybody here. And thank you to the India Cancer Society also for giving me this opportunity. So I will start my talk and I'll share the screen and so yeah. So I hope this is visible. My screen is visible.
Not yet.
Not yet.
Now, yes. Now we can see.
Now, yes.
Good.
Okay.
Yes.
Okay. Fine. Great. So the topic for my talk today is diet and lifestyle for cancer and its prevention. So, I have been counseling cancer patients for their diet since a very long time. And, a lot of people tell me, that we've had a good life, we've exercised, we have eaten relatively correct food. So, why did we get cancer? Right? अब उसका जवाब तो केवल ऊपर वाले के पास है, हमारे पास तो उसका एग्जैक्ट जवाब नहीं है. लेकिन कुछ चीजें ऐसी होती हैं जिनका हम अगर ध्यान दें तो थोड़ा बहुत हम अश्योर कर सकते हैं कि प्रिवेंशन का पूरा एक सिस्टम हम फॉलो करें. तो मैं हर बार उनको बोलती थी दैट सम कैंसर्स ओरिजिनेट हियर in the way you think, stress, anxiety, all of those things. There's mind and body is both related. So you never know when, your thoughts, the kind of thoughts you have, that also affects the diseases that the body starts facing. So something can originate here. And I have to point to my stomach and tell them that some cancers can originate there also. So today I want to focus on that part, the intestines, the stomach area. And I want to, because that's where the maximum food is handled by the body. And I want to focus on that part and what you can do with your food to ensure that, your body is safe from cancer. Or if the person has already been suffering with cancer, has been going through treatment, then these strategies can help you deal with the disease, deal with the side effects of some treatments, and also build your immunity in such a way that you can fight the disease very efficiently. So that's going to be the focus of my talk today. So there are certain terms that I want to focus on. So the connection between inflammation, gut health, diseases, that is physical and mental, food and lifestyle. I will take on these explanations one by one and then connect them all so that you can understand what food and lifestyle does, how it creates diseases in the body via inflammation and gut health. It'll become clear once I start presenting this part. So what is inflammation basically? If one has to understand what is inflammation, so if somebody falls and gets hurt, so you immediately notice some swelling. Supposing my hand has been injured, I will notice some swelling and in that part of the hand. So what is that swelling? Basically, it's an inflammation and it's designed, this is a body's defense mechanism, and it's designed to protect that part of the body and also start healing that part of the body. But what happens is there are some situations where there is internal inflammation going on. We cannot see it. It's not acute inflammation. Acute is कि अभी गिरे, चोट लगी और उसमें से inflammation दिखने लगा. पर अंदर अपने बॉडी के अंदर कुछ केमिकल्स ऐसे प्रोड्यूस होते हैं जो कि इंटरनल इन्फ्लेमेशन क्रिएट करते हैं और ये लंबे टाइम तक ये इन्फ्लेमेशन चलता है एंड वी कॉल दैट क्रॉनिक इन्फ्लेमेशन. सो जब ब्लड टेस्ट किया जाता है So we find there are readings like ESR, CRP. So CRP, C-reactive protein. So when you read that, if the CRP is high, there is an indication that there is inflammation in the body. Now that inflammation is there, that means there is something, some disease process going on in the body, but it doesn't tell you which disease exactly. It doesn't tell you it's cancer. It could be with cancer, it could be with heart disease, it could be with some joint related, like could be with gout, it could be with osteoporosis, with diabetes, kidney disease, any of these diseases. Once it started in the body, you will find that the inflammatory markers, we call these markers, the blood tests have these markers, and the marker will show a high reading. So we know that something is going on inside the body. But when this ESR, CRP is going on, remaining high inside the body, that means there is inflammation, constant inflammation going on inside the body. And that is a red flag. We should get alerted that something is going on in the body. So one is injury. We know that there is an injury, and that's why we've got that acute inflammation. So when these markers are high, then we need to start looking. And it is quite possible that these markers have become high because there is a problem in the kind of food we are eating or the lifestyle we are leading. These are two very common things that happen, and these are in our control. So this is what I'm going to talk about, because inflammation becomes the cause of chronic diseases, lifestyle diseases. You can see, so it's the root cause of most diseases, what I have written in red over there. And you can see all the list of diseases written. This is not a comprehensive list. There are so many more that I can add to this list. So what do we need to do? We have to ensure that inflammation is managed inside the body. Inflammation is brought down so that we bring down the body's capacity to start some big disease, right? So here I'm showing you some of the common causes of inflammation, and I've put arrows to the ones that we can control, the ones which are within our control, what we can modify. One is our diet. Second is something called gut microbiome, which is, I'm going to focus on the diet, on the gut microbiome. And the third is the circadian rhythm. So these are the three things that are very much within our control. And if we don't correct these over a period of time, that means we don't resolve these issues and there is constant exposure, then comes chronic inflammation. It stays in the body for a long time before you start seeing a disease. So I'm going to be focusing on these now. So gut health, there is something when I told you that, पेट से बीमारी शुरू होती है. Basically, I'm talking about the colon, the intestine, right? It affects digestive health, and this in turn affects the immune system. So if we are able to manage the gut health well, our digestive health improves and our immunity stays at a very high level. Why is immunity so important? Even during cancer treatments, there are different kinds of treatments. There could be surgery, there could be chemotherapy, there could be radiotherapy, or even immunotherapy. What is immunotherapy? Immunotherapy is just it's the kind of medication which is boosting your immunity. It is actually stimulating your immune system to start working more efficiently so that it can target the cancer cells. So chemotherapy is targeting it's a systemic medication which targets a lot of cells in addition to the cancer cells. But immunotherapy is not doing nothing directly to your cancer cells. It's just boosting your immunity. So if we can do the same thing through a correct diet, through a correct lifestyle, so that means we are strengthening the immunity of the body, and the body is automatically able to handle these cancer cells. Everybody's body will have some cancer cells, but it doesn't show up in everyone, right? It's possible that somebody's immunity is so strong that we didn't even get to know that the cancer cells have been destroyed, and the immune system has taken care of it in the background without us even getting aware of that. So our purpose should be to boost our immune system to that level. So let's see what is the role of food in this. Now, food can be nourishing in the sense that it can be anti-inflammatory. So we spoke about food which can be inflammatory and which can be the cause or the root cause of diseases. But we have components in our food which can be anti-inflammatory. They do the reverse work. They bring down the inflammation in the body. So food can do that. If you eat the wrong kind of food, the wrong components, it can contribute to inflammation. So food has both possibilities. So what we need to do is to focus on the nourishing aspect or the anti-inflammatory aspect of food. So we have what kind of anti-inflammatory factors are there? Just to name a few of them, we have a lot of antioxidants in our natural foods. I'm going to talk about that. We have prebiotics, probiotics, all this I'm going to introduce. And then we have disease promoters, chemicals which are found in meats, processed meats, chemicals which are found in processed foods. When you open packets, you drink soft drinks, all of those have certain substances, certain components which are promoting disease, they are promoting inflammation in the body. So we need to focus on the anti-inflammatory parts of our diet, of our food. Choose such foods and avoid the ones which contribute to disease. So now this is a very important part, and there is currently an immense amount of research that is going on the gut microbiome. So what is gut microbiome? If we look at our body, और जब कोई बीमार होता है, जैसे किसी को अगर ट्यूबरकुलोसिस हो गया, so what is causing the tuberculosis? It's a bacteria. So it's a disease which is caused by a bad bacteria, or we call it a pathogen. Then there are some bacteria which are beneficial for our body. These are known as good bacteria or probiotics. Now, we want, so where do these probiotics live? Supposing I've eaten, just to give you a simple example, if I've eaten curd. Now, curd has good bacteria in it. When we have a stomach infection, we always say eat curd rice. Curd rice is good for you. Why? Because we want the good bacteria to get introduced into our body, and they, if the numbers of these good bacteria are so high that they can even destroy the or kill the bad bacteria, they can be so powerful. So these are tiny organisms which we can't see from our naked eye, but they are very powerful and they have huge good effects or beneficial effects for the body. So how many of these can live in our body? Where do they live? You can find them in nasal passages, you can find them on the skin, you can find them in the genitals, but the maximum number are found in the colon part of the intestine. The large intestine, we have the small intestine, large intestine. There's a portion of the large intestine which is the colon. Now they like to live in the colon. Now in the colon, if you're able to introduce lots of these probiotics or live good bacteria, they will make colonies over there and have their impact of boosting immunity. That's their whole purpose of being there. So we want more and more different kinds of good bacteria. When we eat curd every day, we are getting only that one lactobacillus. But that's not the only kind of good bacteria. When you see humans, there are so many different kinds of humans, right? Like that, we have many different kinds of bacteria, not only one lactobacillus. So we want a large variety of them. The more diverse the range of bacteria, the better will be our gut health. So that part of the colon where these bacteria, good bacteria live, is known as the gut. So we need to focus on the health of our gut. And this whole, it's called a microbiome. It's an ecosystem. Like we have an ecosystem, they have their own ecosystem inside our colon. And that ecosystem is very dynamic. It can change in 24 hours. That ecosystem can change. If you take antibiotics, you kill the bad bacteria, you also kill the good bacteria. So the ecosystem has got very badly disturbed. So we need to reset that ecosystem and bring it back into balance. So it's dynamic, and that's why we need to pay attention to it at all times. We can't forget about it. Okay, I've got a lot of good bacteria now. I don't need to worry about it. No, you need to worry about it not even worry, you need to pay attention to it on a daily basis. What do these live bacteria or probiotics? We've all heard of probiotics. You get probiotic curd, you get probiotic buttermilk, you get so many probiotic ice creams. I've seen so many probiotic dishes available, I mean, products available in the market right now. So these probiotics, we talked about inflammation. They have the capacity to reduce inflammation in our body, and they have the capacity to build and strengthen our immune system. Two things that are very, very important for us to remain disease free, for us to be able to fight diseases if they have already come into our body. So this is, I'm not going to get into explanation of this healthy gut image, but this is you look at it, there are those, that pink part in the center, that is the barrier. It is the barrier along the intestine, and that barrier is healthy in this, right? But if there is something called dysbiosis, dysbiosis means the bad bacteria have gone up in numbers, tremendous number of bad bacteria have emerged, and they cause inflammation, and the good bacteria numbers have gone down. So there is an imbalance. When this imbalance happens, then there is capacity to contract diseases. So don't let the body get into dysbiosis. What causes this imbalance? Diet, a poor diet, too much stress. Stress, like our mind and our gut, is directly related. It's directly connected. We have something called the vagus nerve. We have something called the enteric nervous system, which is there around our gut. And there is a nerve called the vagus nerve, which is directly connects our first brain and the second brain in the gut. We call that the second brain. There's a direct connection. So if you're stressed here, your gut health or your second brain gets affected. So we have to manage stress at any cost. Stress, anxiety, depression, all of these things will affect our gut health. And if gut health is affected, inflammation increases and immunity decreases. Lifestyle, sleep patterns. We have to have a good circadian rhythm. I'll talk about that little later. So sleep, waking hours, sleeping hours, they have a huge impact on our gut. Whatever habits, chewing tobacco, smoking, alcohol, all of these habits will have an impact on the gut. They're very sensitive. These good bacteria are extremely sensitive. So they respond or they react very badly to all these habits also. A sedentary lifestyle, they need you to exercise also. And exercise, I don't mean like going to the gym or anything, but movement, regular daily movement. So they need you to be active as well. And if somebody is taking too many medications, too many antibiotics, these bacteria are too sensitive to be able to tolerate that, and they can get destroyed. What happens is when somebody is undergoing cancer treatment, like chemotherapy is it is strong. And I agree that at that point, you need the chemotherapy. You must go through that treatment. I'm not at all saying that stop taking those kind of drugs. You must take those. But what happens, you notice that there is some people get extreme constipation, some get diarrhea, there is vomiting, there is acidity, bloating, gas. All these are side effects. They are all related to the gut. So we must pay attention to the gut and to the foods that I'm going to be talking about during the chemo cycles also, so that if your gut is in a good condition, yes, some good bacteria are getting destroyed, but you're also paying attention. So you're reintroducing those good bacteria into your body. These patients will not feel the kind of side effects that others who have not paid attention to their gut, the ones that they feel. And medicines, we just pop medicines without thinking. That's one of the worst things that you can do, because all medication will affect the gut. So if required, please take medicines. But if you can do without it, simple things like antacids. People just wake up and they take an antacid without thinking. Yes, doctor has written antacid over there as part of the discharge when you've taken chemotherapy. They have written antacid, but please judge if you need the antacid. Maybe for 2 days, 3 days after the chemotherapy cycle, after the infusion, maybe you need to take it. Take it for a couple of days and then don't take it and see if you really need it. Most of the time, we realize that you don't need it. What happens with an antacid? What does an antacid do? The stomach has acid. There is reason for that acid to be there. It is needed for digestion of food. That is why you have that acid. In some situations, that acid can come upwards and bother you. Okay, then that antacid is taken. But if you take too much of antacid, this acid that is needed for digestion gets neutralized. It's not available for digesting food. So if you have to do it for 2 days, 1 day, it's okay. But if you do it, if it's a chronic thing, I know of people who had antacids for weeks and months and years. And then they constantly complain of bloating and gas and acidity and that whole indigestion kind of a situation. So you're actually defeating the whole purpose of that acid, which is needed for digestion. So when we take medicines, we must be very clear about why, how long are we taking it, why are we taking it, do we really need it, right? So this is what I said, dysbiosis, bad bacteria becoming much higher than good bacteria. So these are all the different kinds of diseases that we have seen with as a result of dysbiosis. Again, cancer is one of the diseases that can happen because of dysbiosis, the number of good bacteria going down. So let's see what we can do in the diet. A good diet, a diet which has good quality, will always reduce inflammation, it will increase immunity, it will increase energy levels, and it will prevent chronic diseases. This is what a good diet can do for you. So let's see how we can create this good diet and prevent diseases or manage whatever we have right now. So we call these nutrition workhorses. There are four things in our diet which are amazing. They are the ones who handle the inflammation, the immunity boosting power. All of that comes from these workhorses. Now, which is the workhorse? First one is probiotics and fermented foods. I will be talking about each of these. Second is fiber. Third is polyphenols or antioxidants. And the fourth is healthy fats. Now, most of these you find in plants. Animal foods don't have most of these. So I call it the power of plants in your diet. Okay. So we don't need to go into too many details of complicated names and all. I'm just showing you that these are probiotic foods. If you just look at the left hand side column, you have a whole lot of names which some of you may be familiar with these names. There's kefir, yogurt, there's different kinds of cheese, sourdough bread, kimchi, kombucha, miso, sokro, tempeh, pickled vegetables. These are things which are probiotic. There are more. There is fermented rice, what in different parts of the country is called rice kanji, panta bhat, pantua bhat, pakhala bhat. These are all Eastern names from Eastern India. Kanji is a name from South India. Are Indian pickles. Now, all these foods are all probiotic. What is probiotic? All these foods have good bacteria in them. We have this rice, the beetroot kanji, which is a very popular winter water-based pickle, which is had in North India. Very popular. You'll find it in my home also throughout winter. You will find this kanji. I keep making batches of this kanji. So what is it? It's just it's a water-based pickle. You'll find the recipe very easily online. It's called a beetroot kanji. Highly probiotic, very easy to make, and very beneficial because it's got live bacteria in it. Our curd is probiotic. Have your curd, have your buttermilk. That's also probiotic. And then I've shown one thing which is called the second image with the earthen pot. It is a millet ambli. Now, it's a fermented millet dish. Basically, all of these dishes which are probiotic are fermented. And once the fermentation is done, you're not supposed to heat it. So I often get this question that means idli and dosa is also probiotic? No, because you cook it after that. So these are all fermented and then not cooked. They can be consumed immediately after fermentation is complete. So if you look for these fermented dishes, you look for ragi ambli, you look for probiotic beetroot kanji, you look for curd, buttermilk. You can also use Indian pickles, homemade Indian pickles, not the ready pickles which you get in the market, because they all have some preservatives added to them. So as soon as a preservative comes in, the live bacteria cannot live. They will not be able to tolerate. That's the reason for adding the preservative, to kill any live organisms and make it, it will not spoil then. So all of these foods, plus there are so many. If you can have kefir, now kefir has become very popular in India. It's a Turkish drink, very much like buttermilk. You get kefir grains online. All you have to do is put it in warm milk in the night and you have kefir. So you can ask me that, but I'm having buttermilk already. So the bacterial strains which are there in kefir are very different from what you find in buttermilk. So I spoke about diversity, that you need different kinds of strains. Don't stick to only one kind of strain which you find in curd. So what you get in the kanji is different from what you get in kefir, is different from what you get in curd, is different from what you get in ambli. So have a variety of different probiotic dishes and they will always benefit you. Okay. So what happens with this? Like I mentioned earlier, they are the ones which will cause the health, they will make the intestine healthy, and that is going to reduce inflammation. And when that inflammation goes down, immunity is boosted. So two things we are focusing on: reducing inflammation and boosting immunity via the probiotics. Now, what can ruin the probiotics? What can ruin it? I just told you about antibiotics. I told you about medicine. Sugar, white sugar is very bad for probiotics. Many people say sugar feeds cancer. No, sugar doesn't directly feed cancer. It's not like there's a tumor and then when you eat something sugary, it will go to the tumor and feed the tumor and it grows big. No. So what happens is it actually affects the gut health and it increases inflammation and reduces immunity. That's what happens with sugar. Stress, we have discussed. Any chemicals, whether it's on your body through shampoos and soaps, etc., or it's chemicals that you use at your home, or it's chemicals which you find in your food, or the chemicals that comes in your air, all of it is going to affect your delicate probiotics inside your gut. Now, supposing we've introduced those, we've eaten lots of those foods and they've got a lot of probiotics, we've got a lot of probiotics inside our stomach. So, inside our intestine. Now, we need to preserve them. They are living. So, we need to give them the food that they enjoy eating. What do they enjoy eating? They love fiber. They love fiber. So, whenever we are eating, where do you get fiber? Zero fiber in animal foods and loads of fiber in plant foods. Only plant foods can give you fiber. No animal food can give you any fiber. That is why I say the power of plants. So there are different kinds of fiber that are there in our plant foods. Each different kinds of foods that have a diverse diet. Means, you know what is our typical diet? We'll have roti and chapati as the main grain always, and we don't look beyond that. Habitually we eat roti rice every day. Introduce more whole grains. Which whole grains? Like you've got whole range of millets. How many millets, different kinds of millets are available? Buy unpolished millets and consume those. They are very rich in fiber. Remove your rice, white rice. Use unpolished rice. Boil the millets and eat it as a substitute for rice. So we can do a lot of these things. Millets are very good when we are eating our vegetables. Supposing we are making something aloo, we are adding potato to a dish. Now, what do? We always peel the potato. There is really no need. There's fiber on the skin of the potato. Just wash it thoroughly and use the skin. When we eat cucumber, we peel the cucumber. We can chew the cucumber peel. Why not? Just wash it thoroughly. And in that step, if you do, there are many of these vegetables which you can use the peels. And when you're using the peels, you're getting extra fiber in your diet. So even things like rajma, chana, all these have fiber, onion, garlic, all have fiber, all your fruits, all your vegetables, all of these have fiber. So include a lot of diverse vegetarian foods, plant foods, I should say, and they will give you plenty of fiber in your diet. Then we have something called polyphenols, which are the different colors in food. We always say eat like the rainbow. Why eat like the rainbow? Every single color gives you a benefit. These are antioxidants, and every antioxidant will give you great it has great properties of it. One, it helps the gut bacteria very happy when they get different kinds of polyphenols or antioxidants. It reduces the oxidative stress. What does that mean? When there is stress in the body and it damages the DNA of the cell, which is the starting point of cancer, these colors are the ones which can protect the cells from this kind of damage. And the whole microbiome, your gut health moves to a healthier state. So make sure that you eat all kinds of colors that you can see. Again, we tend to eat, if I ask anybody which vegetable do you eat, हरी सब्जी खाते हैं. हरी सब्जी बहुत अच्छी है, लेकिन हमारे पास बहुत सारे डिफरेंट कलर्स हैं. कुछ रेड खाओ, कुछ ऑरेंज खाओ, कुछ पर्पल खाओ. Eat every color possible. Have the maximum diversity in terms of colors, right? Make a salad with different colors, make vegetables with different colors. So all your capsicums of different colors, you have cabbage of different colors. Include everything in your diet. Okay, then we have healthy fats. Many people eat a lot of bad quality fat. So there is something called omega 3, which originally comes only from fish, certain fish. But if you're not, willing to have the fish oil capsules, those are anti-inflammatory capsules. This omega 3 is anti-inflammatory. So that also helps. But if you are not willing to have the fish oil capsules, you can have vegetarian, the algae fish, the algae capsules. Those are little less efficient, but they will convert into omega 3 in the body. Then flaxseed oil, flaxseed powder, seeds, walnuts, all of these have certain fats which need to go into the body and then get converted into omega 3. So for vegetarians, that option is there. For non-vegetarians, you can have these oily fish, or otherwise you can have the fish oil capsules. Any food which has excess salt, sugar, and fat, and the combination is very deadly. And all our processed foods have this, any two in combination. They hack your brain. Sugar and fat hacks your brain. Salt and fat, namkeens, all desserts, all cakes, pastries, they are a combination of two of these. They hack your brain to want more and more and more. And they will ruin your gut. They will kill the bacteria and cause dysbiosis. So we have to keep away from this. So we have this, there is one Dr. Manikam, and I love this saying of his. He said, every time you tear a packet, any chips packet, etc., you tear a part of your gut. So your gut health gets ruined when you pick up packets and eat out of packets, ready foods, right? So I love this statement of his, and I have been using it, and I've acknowledged him. Beverages, alcohol, it ruins your gut health. There is a thing that, okay, one drink is good for the heart. No, 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 it's not. There is no such research now which says one drink is good. No drink is good. Now I come to one short part which I will finish, and then I'll keep the floor open for questions. You must time your food, what you eat when. Very important. We have a body clock, and if we stay in sync with the body clock, our body is happy. And we are in sync with the body clock means, if you see, like from 4 a.m., the body wakes up. Body also needs to rest, right? We need mental rest, we need physical rest, and we need digestive rest. So at night from 8 p.m. till about 8 a.m., we should have digestive rest, at least till 8 a.m. Okay, have digestive rest, don't eat anything, body is resting. Why do you need to give your digestion rest? So that the body can start clearing out bad cells, damaged cells, and starts healing and recovering. That's what the body needs to do at night. And during its recovery time, if you start feeding the body, which many young people eat at 1 in the night and 2 in the night while watching something on Netflix, that's actually ruining their health because the body is not getting a chance to recover and repair itself or get rid of bad cells, right? So timing is very important. In the morning from 4 a.m. till about 12 noon, the body is in a cleansing state. It wants to clean itself. So we pass stools. We need to eat foods which are light and which help the body to clean up. So what does the body need? Drink water. Water helps to clear up. Have a lot of liquids. Have a lot of fruits. What do fruits, salads, what do these have? They have fiber. Fiber acts like a jharu, like a broom. The fiber cleans up, takes out all the waste, and helps to form stools and throw it out. So support the body in its function. If you go against the body and the function that the body is doing, somewhere the body will react and say something to you that, okay, come on. It will show you signs of ill health. राइट। फिर 12 से 8 बजे का क्या टाइम है? अग्नि। जब सन एकदम हेड पे जाता है, उस टाइम पे वो सन की जो अग्नि आती है, दैट इज एक्चुअली एन डाइजेस्टिव फायर इंक्रीजेस। सो बिटवीन 12 एंड 8 eat your cooked foods, eat lots of cooked foods, and that will get digested very easily by the body. So you just stick to these timings. Don't drink tea first thing in the morning. No coffee first thing in the morning. You're only increasing the acidity of the body by first starting your day with tea and coffee. Get rid of that habit. Shift it to a later time if you must have it, but not first thing in the morning. So eat a plate. See this plate? Eat up. Your plate should look like this. Half the plate must have vegetables. We've understood why vegetables. We've understood what is good about vegetables, right? All the fiber, all the prebiotics. Half the plate must have cooked vegetables, salad. That much vegetable should be there. 1/4 of cereal, your roti, rice, millet related dishes, 1/4. That's enough. And 1/4 of your dal, and along with that you can have curd, buttermilk, and I've shown you beetroot kanji on the side. Have that also because that is your probiotic. Try to have 3 4 probiotics in a day. Twice a day you can have curd or have buttermilk once, curd once, kanji once. Then that millet ambli that I told you, you can have that sometimes. Have a little bit of homemade pickle. All of it is good. And in the morning, when I talked about cleansing and more liquids and more fruits, you can have green juices, you can have red juices, but all juices should be vegetable juices, not fruit juices. Okay, vegetables have a lot of power and they don't have excess sugar. When you make an orange juice, you're taking too many oranges and removing all the fiber. So mix vegetables and make a juice out of it. So, which are the most powerful? All plant foods are powerful. Very powerful is turmeric. अपना हल्दी, जब भी हल्दी खाइए उसके साथ में थोड़ा सा ब्लैक पेपर, थोड़ा सा एक चुटकी मिक्स करके खाइए। ऑलवेज उसका जो कर्क्यूमिन है उसका इफेक्ट आपको बेस्ट मिलेगा। बेरीज, बेरीज में आपका अगर इम्पोर्टेड बेरीज नहीं लेने हैं, हमारे पास इंडिया के भी बहुत सारे बेरीज मिलते हैं। आंवला भी बहुत पावरफुल एक बेरी है। ओके, इंडियन गूसबेरी बोलते हैं उसको, वेरी पावरफुल बेरी, यू मस्ट हैव दैट। ब्रासिका फैमिली, मतलब ब्रोकली, कॉलीफ्लावर, कैबेज, अगर ब्रसल्स स्प्राउट्स मिलते हैं, लेकिन ब्रोकली, कॉलीफ्लावर, कैबेज तो आपको मिल जाता है सब जगह। यू मस्ट हैव one of these every day. Powerful anti-cancer foods, very powerful. सिट्रस, जो भी विटामिन सी रिच सिट्रस फ्रूट्स हैं वो जरूर लीजिए। बहुत सारा लेमन लीजिए अपने डाइट में, स्पेशली जो कैंसर ट्रीटमेंट चल रही है जैसे कि कीमोथेरेपी। नींबू और अदरक का रस मिला के उसको लंच के बाद में, डिनर के बाद में लीजिए। आपको कभी भी कोई नोजिया, वॉमिटिंग, डाइजेस्टिव प्रॉब्लम्स नहीं होंगे। ग्रीन लीफी वेजिटेबल्स बहुत लीजिए, बहुत पावरफुल होते हैं। सब वेजिटेबल्स वैरायटी रखिए। गार्लिक इज वेरी गुड, स्वीट पोटैटोज आर एक्सीलेंट, पंपकिन इज एक्सीलेंट। अगर कुछ चॉकलेटी खाने का मन करता है तो ककाओ, रॉ कोको होता है उसको बोलते हैं ककाओ। ककाओ के पाउडर ले सकते हो, उसका आप स्मूदी में डाल दो, किसी भी चीज में कॉफी बनाई तो उसके अंदर ककाओ डाल दो, तो इट्स वेरी पावरफुल। ग्रीन टी इज वेरी गुड, मशरूम्स आर वेरी गुड, एंड ओमेगा 3 जरूर याद रखिए अपने डाइट में। ओके, स्लीप का मैंने आपको बताया। तो जो भी आप करो, फूड्स में पॉलीफिनॉल्स, प्रोबायोटिक्स, फाइबर, ओमेगा 3 एंड क्रोनो न्यूट्रिशन, टाइमिंग्स, ये सब चीज को याद रखिए। इसके साथ में थोड़े एक्सरसाइजेस करिए और रेस्ट करिए अच्छे से, एंड यू विल बी गुड टू गो। यू विल हैव इमेंस इम्यूनिटी एंड एंटी इंफ्लेमेटरी फूड्स। तो ये 400 बीसी में जो डॉक्टर थे तब के हिपोक्रेटिस, उन्होंने लिखा था, लेट फूड बी दाई मेडिसिन एंड मेडिसिन बी दाई फूड। So we recognized in 400 BC that food can be your medicine. So let us remember that and treat food as our medicine. Thank you.
Thank you. Thank you, Dr. Punamji, for a commendable and most interesting takeaways for the entire audience. Two things which are, I mean, which I have noticed: the statement of honeycomb and the chrono nutrition. These are kind of a commendable and most insightful uh, wisdom knowledge you have shared. Now I have one important question
Yes.
uh, for the and it is about good bacteria and bad bacteria. Of course, I keep on living even in London from time to time. What I have noticed that in India, for any particular disease, etc., antibiotics are prescribed like chocolate and things like that, which is opposite to UK, where they prescribe antibiotic only on SOS basis. So why is that particular difference in the prescription or in the mindset of medical professionals in India and UK?
So, I'm so glad you brought this up because there was a very recent report. There was a research done by AIMS Delhi where we found that in India, the antibiotic consumption is very high, and there is, antibiotic resistance has developed in the Indian population. So they are not able to even respond to antibiotics when they are really needed. So people take antibiotics very lightly. One thing is that they are available over the counter. So I think, in UK, that difference is there. They are not medicines, very basic medicines are available over the counter. I myself seen it that you cannot access in most of the Western countries, you cannot get antibiotics over the counter. So Indians have they treat antibiotics and dolo so casually that they have themselves developed this resistance to antibiotics. I think that is the only reason.
Thank you.
Dr.
And
Vaswani, I have a query.
Yes.
Shrenik, can I ask?
yes,
Can you
yes,
just tell
please,
us,
yeah.
nowadays on social media, they're all talking about Indian diet being protein deficient and have these protein powders and your immunity will become better, etc., etc. So, what role do you think is there for these protein powders?
Okay, so the first thing is that we need to first assess our own diets.
Mhm.
How much protein have we tried to consume through our diet? We have enough. So the concern is more with people who are vegetarians and vegans. Non-vegetarians anyway don't have a much of a concern if they are regularly consuming non-veg. If they are not consuming, there are non-vegetarians who would consume non-veg foods maybe once in a week or once in 2 weeks. They call themselves non-vegetarian, but they are not consuming adequate non-vegetarian food. So I
Yeah.
would put them in the vegetarian category only. So one thing is we need to first assess. As a vegetarian, have I tried my best to include enough protein rich foods? We have plenty of protein rich foods. We've got all our dals, we've got all our pulses, we've got those who drink milk and they can make paneer out of it, right? And we need to only ensure that we are combining, there is something called cereal pulse combination. Okay. What is a cereal pulse combination? If you eat cereal separately, they are not giving you excellent quality proteins. If you eat pulse separately, there is something lacking there also. But when you put them together, they are giving you excellent quality protein. You know, when idli and dosa batter is made, it is already a complete protein. It is already a good quality protein because that basic recipe is combining a cereal and a pulse. So first thing we have to ensure that we have these combinations in our diet. What people do is they take roti and then they take sabji, especially when they are going to work. They don't want to carry dal which spills and it comes out of the tiffin and all. So they carry roti and sabji. So that's when I tell them that no, you have to have a source of protein. How will you do that? You don't want to carry liquid dal. Fine, take some sprouts. Take dry sprouts, take dry chana, dry rajma. You are then combining your cereal and your pulse and you're getting good quality protein there. So that is one. How you combine your foods, you're able to get your protein there. Make sure you include things regularly in every meal. So if you're eating, say, poha in the morning, put some peanuts in the poha, put a little paneer or put some sprouts in it. It's boosting your protein. At lunchtime, you can have a bowl of curd. You should do your dal along with your cereal. So you are getting adequate protein. In the evening, you can have a sattu drink. Sattu is also very good, high in protein content. You can do a sattu drink in the evening. Then at night, again, make sure that you have adequate protein. You could do if you eat egg, then egg is there. If you don't eat egg, you can do paneer sometimes. You can do tofu. Tofu is very good as well. So you can do tofu, you can do curd, buttermilk, have it with the khichdi, have a cup of milk at night. If you think of it like this and ensure that you are getting some protein at every meal, you can make up your protein needs, you can meet your protein needs. But if you feel after doing everything, I'm still not able to eat this much, I'm not able to include it, you can take judge your protein powders correctly. You can take some protein powder, but it doesn't have to be like there's a scoop inside, so I have to put 4 scoops and take all 4 scoops. No, maybe your need is only short of maybe 1 scoop or 2 scoops. So we don't, people just do things blindly without understanding. So that should not happen. You have to first assess and then fill up the gap which is showing up in your diet. But just because a person has started exercising, they start taking whey protein powder, there is no justification for that. They may not even, from the first day of starting the gym, you start taking protein powder. Have you even tried changing your diet or improving your diet? First is that step, right?
Thank you.
Welcome. So I think there are some questions.
Yeah, that
Yeah.
is one question from Manisa.
Hi,
Just for a second. Like she's asking, like when and how the fish oil is to be taken. If you would like
Fish
to
oil, yeah.
answer, yeah.
Yeah. So you get these omega-3 capsules. So fish oil, you can take it as capsules. So you buy those capsules and it should have at least 1,000 milligrams of fish oil in it. And you can take it after breakfast or after lunch. So the only concern with fish oil is sometimes people get a little fishy burp, but it's okay. I mean, you can ignore that. So after breakfast or after lunch, best time. Yes, Rajesh ji, you have a question?
hi. It's been a lovely session. Okay, I have an important question here. Can you talk something about autoimmune disorders and what protocols or what should be the guidelines? I know the entire presentation throughout the presentation you've given many insights, but
Yes,
yes,
yes.
if you want to add some points with
Yeah.
regards to autoimmune disorders, thank you.
So if you know the term autoimmune means what? The immunity, our body's immunity actually starts destroying or uh, it attacks its own cells. So when does
Correct.
this happen? So when does this happen? It could happen because again there is inflammation in the body. So any autoimmune problem, you first address the inflammation in the body, right? So your principles will not change. The principles that I have mentioned will not change. So you have to, one, it could be possible that a person is allergic to certain foods. In some cases, especially skin related autoimmune problems, there could be some allergies. So, one, I think you could check out if there are any allergies, and that can be done by some simple tests. And you can also check there are tests to check the gut microbiome now. There are some beautiful tests which can be done where they test your gut health and see what is missing in your gut health. What are the microbes missing? So this is an advanced test. It's about 7 to 10,000 rupees. It is a little expensive, but if you can get your answers from there, then you will be able to work on it in a targeted manner. And otherwise, whatever principles that I have told you will still apply.
Thank you.
Welcome.
Uh, one more question. I mean, since you are from Gujarat and majority in Saurashtra, after the lunch they consume like chash or
Yeah.
that were made from yogurt. So, what
Yes.
exactly the reason is? If you can share your expertise.
Yeah, so charge, see, there's one thing it's cooling for the body because it's in Gujarat, especially, it's very warm. So, there is a high chance of dehydration. So, this makes a good drink to hydrate the body. And second, it's probiotic, right? So, our ancient wisdom also is beautiful. Our ancestors had realized, what kind of diets our body require. So, chach is probably been introduced. I mean, it's a traditional thing from the probiotic gut health point of view. But I would like to add one thing here that, when people consume, especially when you talk of Gujarat, most people in Gujarat are vegetarians. And the question that came for protein, we all need at least a certain amount of protein in our diet. And Gujarat, I've seen the food is very carbohydrate rich and it is slightly low in proteins. So we must focus on proteins, all vegetarian sources of protein. I am not saying include any other protein. Vegetarian sources, make sure there's protein in every meal. And what happens with charge is we dilute it, right? We take curd. If you take one bowl of curd versus one glass of buttermilk, there is a big difference in the protein value. You will get the probiotics, but protein value is much lower in buttermilk because you have added so much water and diluted the curd. So we need to have more thick curd. Maybe, in the morning with breakfast, you can have a bowl of curd. And then if you enjoy charge with your meals, you can have charge for lunch and dinner. This is especially for vegetarian diets. I get very concerned that their basic protein requirement is also not met. So just by making these little changes, we can improve the protein intake.
Please put it, please unmute yourself and you can ask question directly.
अनम्यूट करो अपने आप को अनम्यूट
Ha, Puniche, yes.
Yeah, hi ma'am. It was a wonderful session,
Thank
and
you.
I'm so sorry. I'm very poor with this
It's okay.
laptop
It's
and
all right.
everything.
Don't worry. Don't worry.
Yeah, ma'am. I just want to know that people are. I've met so many people. I go to gym, and they are very obsessed with one OMAD. One time a meal a day. So is it good or bad? Because when I tell them it's very bad, then they called me crazy. You are
So
crazy.
there are so many different formats of eating. One meal a day. If you heard of Sadhguruji,
Yes,
he
I
eats
follow
one meal
him.
a day. He eats one meal a day. It works for him very well. Okay.
Yeah.
But if I eat one meal a day, maybe it won't work for me. So we actually should not have these fixed notions about things. So why are people now suddenly following one meal a day? Is because they probably want to lose weight. If in that one meal they are able to take all the nutrients that their body requires for the whole day, go ahead. That means they will have to eat some 1500 calories, 1200 calories in one meal. If that is
Yes.
possible for a person to humanly do and meet all the nutrient requirements, I have no problem. But I don't see that possibility. So,
Okay.
again, it's a fad. Fads come and they go. They come and they go. What stays is a healthy, balanced diet.
Ma'am, they're still like, they like 50 kgs or 60 kgs. That's it. And still they are doing, one-to-one session for the gym and everything. So I
So
think
that's why I
that
said
it's a
that
bad for them.
each person is different. We don't know what actually they are eating, how they are eating. We really don't know. I find it difficult to comment on this because I really don't know what they are doing otherwise.
Yeah, yeah, yeah.
For
Thank,
each
thank you
person,
so
it's a personalized, recommendation.
much. Yeah.
Yeah,
Thank you so much, ma'am.
welcome.
Next question.
Actually, this is outcome of internet and WhatsApp university. People are following things blindly, and then they invite problems like anything.
Yes.
And not only that, they keep on promoting कि मैं ये करता हूँ वो करता हूँ, and slowly and gradually people are, I mean, following everything like that. Is there any question part anybody would like to ask question? Because I want to make one announcement, and we have 4 minutes left. Anybody would like to ask question to Dr. Poonam?
Sir, there is no question further.
Okay. Yeah. I can just see one question here in the
Great,
chat
great.
box that can we add skim milk powder in recipes to increase protein? Yes, you can. And if you need more calories and more protein, you can use whole skim, not skim milk. You can use whole milk powder also. If the person doesn't have any cholesterol issues, etc.
Right.
Okay, I have a
And
question. I have a question. So we are seeing many senior ladies going through knee transplant. Okay, and the reason why they're doing that is because the cartilage has diminished. Okay, is there any way by which we can regrow the cartilage by infusing collagen supplements, right? And how can these collagen supplements be taken? Thank you.
So collagen, see, there are two kinds of collagen supplements. One is, so there are different kinds of collagen also, collagen supplements. One is you have the vegan ones, which are collagen builders. So they are nutrients like vitamin A, C, E. They help to make collagen. So they are not directly collagen. These are for people who are vegetarians and vegans. Now, collagen, where does it come from? It comes from bovine bone, or it comes from, the sea collagen, also the sea fish, from there also it can come. So you have different non-vegetarian versions of direct collagen. And within collagen also, in these, the supplements which you add to water and drink and all. So that there also you have some collagen which can help with your regeneration of the collagen in the joints. Then there's another collagen which is for the skin. So collagen also is not one kind. So when people decide to take collagen, now infusing it directly into the knee area, that is not my subject. That would be, you'll have to go to a medical doctor for that. But I can only talk about the food part of it, that you have to, it can help to a certain extent, but I don't think it can completely replace the old collagen and you get, completely new collagen can take its place. If that was so easy, then there would be very few knee surgeries done. So I know that it's not, that wear and tear can only be managed to a certain extent, but what I can say is that strengthening exercises with, what happens is the knee is taking the strain, but if you strengthen through strength training, if you strengthen the muscles around the knee, that strengthening can take away the knee pain. So you can avoid the surgery with strengthening of the leg muscles. It has to be done with a physiotherapist because they know which kind of exercises to be done, but it helps in a very large way. I know of people who've been able to avoid their knee surgery with the strengthening exercises. And then you take collagen along with that. So both things together will give you good effects.
Thank you.
Yeah,
I have a
uh,
question.
yeah.
I mean, in case of vegetarian people, if can we get sufficient omega 3 in 1 tablespoon of flax seeds or 2 walnuts a day?
No,
If
you have
not,
to do.
how much omega 3 supplement in capsule form we should take, and how what should be the duration? For how long one should take that?
Duration is permanently in life. You need omega 3 every day. So we can't stop it. You can, okay, finish one bottle, stop for 5, 10 days, and then start again. But we can't completely that, okay, it's not like vitamin D that you did a 2 month course and then after that you're sorted for the next 6 months. It doesn't happen like that. It has to go on and on. So there are different kinds of capsules, with different potencies. So we need to see the brand name and then see how much you will require of that particular brand name. But you should continue having your flaxseed. You can do flaxseed oil, like instead of, olive oil sprinkling on your salads, you can do seeds, walnuts, all of this. Keep bringing it into your diet.
1000 mg you should it should be in the form
That 1000 I said for fish oil.
of fish oil. Thank you, ma'am.
Welcome.
Yeah, you can unmute and ask question. Yeah, Parmar.
What role does NCDs have in increasing the inflammation in the body? See, diabetes or hypertension. Does that
So
also cause an inflammation in the
So
system?
inflammation it starts with inflammation and then you will see overt
Chronic
diabetes or
diseases.
heart disease. Yes, yes. I showed you the entire list. No, those are all lifestyle diseases. Those are all NCDs.
Hmm.
All right. So I assume there is no more questions. Dr. Poonam, thank you so very much
Thank you.
for giving us insights, wisdom, experience, knowledge, and all your expertise for 25 years to us through this Indian Cancer Society. Friends, I have two things to mention here. Whoever is attending this session, you can find the YouTube link of today's live session, and I would like you to share across all your network for the better outreach. That is number one. Number two, Dr. Puramji, with your permission, I would like to make one announcement. Uh,
Yeah, sure.
30th, 30th of March, 30th of March is Women's Day, and we are going to celebrate that Women's Day. And I have invited a very, very eminent medical oncologist. She is going to talk about the importance of HPV vaccine to prevent cervical cancer. Of course,
Yes.
we will be sharing the invite and all other details when in time. But I want everybody to join and attend and also spread the word because for no reason. Number one, we want to celebrate the Women's Day in a big way. That is number one, and we want to prevent the cervical cancer for the existing and new female or women community. So, Dr. Poonam, thank you once again for your valuable
Thank you, sir.
time, and it was lovely having you. And we look forward to invite you in a very near future. Thank you so much,
Thank you,
and
sir.
thank you,
Thank
friends.
you. Thank you. Thank you, everybody. Bye bye.
Bye.
Good. कहाँ हुई रिकॉर्डिंग स्टॉप मेरी तो गई नहीं